Hello, my name is Paul Geelan. I'm an ocularist from Western Australia. I consult at Moorfields Eye Hospital, Dubai, and I also have a practice here in Western Australia where I work with my sister Jenny and my daughter Emily at Artificial Eye Services. Today I'm going to talk about the operation to have an eye removed, and this is part of a series of talks that we're putting together based around the Mindmap, adjusting and adapting to eye loss. We found that when patients came to see us for the first time, we'd share a lot of information with them. So we've broken this down into a mind map where we can talk about the operation, how do we make the artificial eye, sports, driving, how's it going to affect your life, and also provide some support services as well. The talk today is about the operation, having an eye removed. So why would someone have an eye removed? There are two basic reasons. One is if you have a blind, painful, unsightly eye. Living with pain can be very debilitating and really affect someone's life very negatively, and just to help get on with their life, sometimes it's easier to have the eye removed and then have an artificial eye fitted, which is cosmetically better and just helps people move on with their life. The other reason would be is if there's a tumour in the eye and the doctor will want to remove the eye to prevent malignancy and the cancer spreading to the rest of the body. So there are two operations that the doctors will do. Either they'll do enucleation or evisceration. So enucleation would be performed if someone has a cancer, and that is removing the whole eye. The muscles are separated away and the eye is removed, and then a ball is implanted back into the eye socket and the muscles are attached to that ball. With the evisceration, basically the iris and the cornea are removed from the front of the eye and the contents of the globe are removed, but the sclera is still there. So the muscles are still attached to the sclera, and then a ball is implanted into the eye socket, or into the sclera, into the pocket, and this allows a range of movement. With the movement of the eye, you won't get 100% movement. There will always be a little bit of slip underneath the eye, underneath the shell. But it should pick up most of that movement. So you'll have conversational movement. When you're talking to people and you're just small movements of the eye, you should be able to pick up with the artificial eye. But bigger movements, when you're looking over your shoulder, you won't have that movement so much. In the eye socket, you have the conjunctiva underneath the eyelids, and this comes to the front of the eye and connects around the cornea. It comes up the front of the eye. So if you get conjunctivitis, your eye will get red. Basically, when you have the eye removed, the conjunctiva is pulled across the front of the ball and there will be a neat line of stitches. So when you look into an eye socket, what you'll see is the volume of the eye is filled out and it'll be pink. It's not like you'd expect. If you have an eye removed, you'd expect a large cavity or a large space for fitting an artificial eye, and you'd expect maybe a sphere or a round ball to put in there. It's never like that. It's you've got a clear shell, an artificial eye that fits over the ball, which will pick up that movement. This sits underneath the eyelids, it's supported by the eyelids and sits over the ball. During the operation, a conformal shell is placed into the eye socket. A conformal shell is just a clear plastic lens that fits into the eye socket to form the space of the eye socket so that an artificial eye can be fitted at a later date. And it also prevents the eyelids blinking over the suture line. So you'll have the suture line across the front of the ball, and then the lids won't be rubbing on that because you have this clear lens in there. In the first couple of weeks, there will be a lot of swelling. It's not a big operation, but there is healing time involved with this operation, and there will be swelling, maybe a little bit of discharge. You may even have a little bit of blood in the tears. It is possible that the conformal shell can fall out. This is due to the swelling and initial stages. There might be a bit of discharge or inflammation in the socket. So if it falls out, the important message here is don't panic. You can come back to the clinic the day after, you see your ocularist or your ophthalmologist, or go back to the hospital where you had the eye removed, and someone can wash the shell and fit it back into the eye socket. You don't need to rush off to emergency if the shell falls out, and please don't call your ocularist at 4 o'clock in the morning. It's not necessarily to have the shell there. It is good to have the shell there, but it can wait. If we look at our mind map on the operation, we have a few suggestions. First is avoid alcohol prior to the operation. You'll be having antibiotics and anesthetics, possibly steroid eye drops. You're having this cocktail of drugs, and you don't want to mess this up with adding alcohol to the mix. Basically, we recommend a healthy liver, a healthy body, so just try and stay healthy prior to the operation. As I mentioned, there's a conformal shell in the eye socket. This may fall out. Don't panic. With the operation, you really need to give yourself time to heal. So you don't want to put pressure on the arc. The conjunctiva is a very thin tissue across the front of the ball, the implant at the back. If this separates or the muscles separate, it creates complications, and then you need to go back and have further surgery. So we recommend keep the pressure off your head. Just use an extra pillow when you sleep. Avoids adding pressure, and no heavy lifting. If you've got children or shopping, hopefully you have someone who can help you with these things. If you want to exercise, it's a good idea to go walking. If you do need to pick things up, don't bend over. Bend your knees, squat down and pick them up. After the operation, still take it easy with the alcohol. There is a healing process, and it's going to help with the healing. We also mention here that you want to avoid using body sprays or hairspray or aftershave, because these chemicals can affect the artificial eye. It'll actually eat into the plastic of the artificial eye. So you can use these things, but just be careful, make sure your eye is properly closed when you do this. So that's basically the operation. That's our first talk. If you have any questions about this, you can contact me through the website, artificialeyes.net, or I will have the email in the description below. I do want to point out that I'm not a doctor, and so the advice that I'm giving you today is just some thoughts that I've got from my 30 years of making artificial eyes and talking with doctors about patients. But it's not medical advice. If you do have specific medical questions, please contact your ophthalmologist. I hope you find this helpful, and thank you very much for watching.